Arterial tortuosity syndrome, or ATS, is a rare and severe genetic disorder affecting the body's arteries. These vital blood vessels, normally straight and elastic, become elongated, twisted, and prone to aneurysms and dissections. This can lead to a range of life-threatening complications, affecting the cardiovascular system, respiratory system, and other organs. This video will explore the causes, symptoms, diagnosis, and management of this complex condition. ATS is caused by mutations in the C2A10 gene. This gene provides the instructions for making a protein called GLU10, a glucose transporter. GLU10 plays a crucial role in the transport of glucose and its metabolites, particularly dehydroascorbic acid, the oxidized form of vitamin C. Mutations in SLC2A10 disrupt this transport process, leading to a buildup of glucose metabolites and impaired vitamin C metabolism. ATS is inherited in an autosomal recessive manner, meaning that both parents must carry a copy of the mutated gene for their child to be affected. The precise mechanisms by which GL10 mutations lead to arterial tortuosity are still being investigated. However, it is believed that the impaired glucose and vitamin C metabolism disrupt the formation of collagen and elastin, the proteins that provide strength and elasticity to arterial walls. This weakening of the arterial walls results in elongation, twisting, and an increased susceptibility to aneurysms, where the artery bulges outwards, and dissections, where the artery wall tears. Arterial tortuosity syndrome is an extremely rare condition. Due to its rarity and potential for misdiagnosis, the exact prevalence is unknown. Cases have been reported worldwide, but it is likely underdiagnosed. Given its genetic nature, the risk of recurrence in families with a previously affected child is 25% with each pregnancy. The signs and symptoms of ATS can vary widely in severity and presentation. Common features include markedly tortuous and elongated arteries throughout the body, visible on imaging, pulmonary artery involvement, leading to pulmonary hypertension, skin abnormalities, such as cutis laxus illus, sagging skin and easy bruising, skeletal abnormalities, including joint hypermobility and pectus excavatum or carinatum, hernias, and eye abnormalities. In severe cases, aneurysms and dissections can occur, leading to life-threatening complications such as stroke, heart attack, or organ damage. Diagnosis of ATS typically involves a combination of clinical evaluation, imaging studies, and genetic testing. A physical examination may reveal the characteristic skin and skeletal abnormalities. Imaging techniques such as angiography, CT scans, MRI scans can visualize the tortuous arteries and detect aneurysms or dissections. Genetic testing to identify mutations in the SLC2A10 gene confirms the diagnosis. While ATS is a single genetic disorder, the severity and specific manifestations can vary considerably. There are no specific classifications or subtypes defined, but the clinical presentation can range from mild arterial tortuosity with minimal symptoms to severe arterial involvement with life-threatening complications. There is no cure for arterial tortuosity syndrome. Treatment focuses on managing the symptoms and preventing complications. This may involve medications to control blood pressure and reduce the risk of aneurysms and dissections, surgical repair of aneurysms or dissections when necessary, monitoring for pulmonary hypertension, and treating it with appropriate medications, physical therapy to manage joint hypermobility, and regular follow-up with a cardiologist and other specialists. Vitamin C supplementation is often recommended to address the impaired vitamin C metabolism, although its effectiveness is still under investigation. As ATS is a genetic disorder, there is no known way to prevent it from occurring in affected individuals. Genetic counseling is recommended for families with a history of ATS to assess the risk of recurrence in future pregnancies. The prognosis for individuals with arterial tortuosity syndrome varies depending on the severity of the condition and the effectiveness of treatment. Early diagnosis and management are crucial to improving outcomes. Aneurysms and dissections are the most serious complications and can be fatal. Ongoing research is focused on understanding the underlying mechanisms of ATS and developing new therapies. For example, studies are investigating the role of specific glucose metabolites in arterial wall remodeling and exploring potential therapeutic targets to improve collagen and elastin synthesis. Further research is vital to enhance the quality of life and extend the lifespan of individuals living with this challenging condition.